you see your patient, they come in a very bad state, and then you see them going home the next time looking good, looking wonderful, all recovered. You'll be feeling so good. You feel, oh, my effort has yielded a good result. Bedside nurses actually experience lots of physical, mental, and emotional stress. Yes, it's actually very stressful. Hello, beautiful people. Yeah, it's your girl Esther, one and only Lolo Obieze. Yes, today I've come to say something that's been bothering me. Yeah, I need to say it out. I need to talk it out. I need to verbalize it. Yeah, the nurse can do everybody's job, but not everybody can do the nurse's job. Yeah, so I've been a registered nurse for over 8 years now, and there's this particular topic. From my experience, I've been doing bedside nursing. Yes, most of my practice area has been bedside nursing, and I have a lot to say about bedside nursing. What is bedside nursing? Because some people will be like, what is bedside nursing? Bedside nursing actually means working directly in contact with patients. You are coming solely in contact with patient care, doing their drug administration, doing everything for the patient. Yeah, you are looking after the patient each time you come to work. You are doing direct patient care and doing every other thing for the patient. You are coming in contact, direct contact with the patient. Yeah, it's quite different from other specialties in nursing or other aspect of nursing, like the nurse informatics, nurse educators. Yeah, these other nurses do the nurse teaching, nurse giving informations and all of that. But bedside nursing simply means coming direct in contact with the patient, doing their care, doing their drug administration, doing everything solely for this patient. You are coming in contact with this patient every time you come in for work. Yeah. So, what do I want to say about bedside nursing? Today, I have lots of things to talk about regarding bedside nursing, because it's actually a topic that people fail to talk about. Nurses, they keep complaining, issues arising, especially recently, coming from bedside nurses. Because it's a lot. Stay tuned while we talk about this particular topic. And if you're seeing my face for the very first time, it's your girl Esther. This is Lolo Obieze. Yeah, so don't forget to like this video, share, comment, subscribe. I want to hear your own opinion in the comment section. Let me know how you feel about bedside nursing, especially if you're a nurse practicing in the UK. Okay, so let's dive in without wasting much of your time. Let's dive into this topic. Working as a bedside nurse can be very fulfilling and rewarding. However, it can be very tasking on the body. Why do I say so? Of course, if you're a bedside nurse, you can agree with me that when you see your patient, they come in a very bad state, and then you see them going home the next time looking good, looking wonderful, all recovered. You'll be feeling so good. You feel, oh, my effort has yielded a good result. You see yourself feeling happy that your patient has actually recovered from their disease or illness. This is actually rewarding and fulfilling. However, bedside nursing can be very tasking on the body. Yeah. Bedside nurses actually experience lots of physical, mental, and emotional stress. Yes, it's actually very stressful. Physically, mentally, and emotionally. It is very, very stressful. I can say that. While I enjoy working in direct patient care, things have actually changed over time, and bedside nursing is increasingly harder, which is not very okay, which is not very good, and people are talking about it, and this is not very good for the nurses. Recently, bedside nurses are expected to do more with little. I don't know if I should say this is due to corporate greed. I don't know, seriously, I don't know if I should say this could be due to corporate greed or due to an oversight. I don't know what is missing somewhere. I feel something is actually going wrong, because the bedside nursing care is becoming increasingly harder and should be looked into. Bedside nurses are constantly adapting to the new changes with the healthcare system just to keep their patients and the public safe. This is actually very important. Nurses, especially bedside nurses, they have to keep updated in their knowledge. They have to keep adapting to the constant changes with the healthcare system just to keep their patients safe, just to keep the public safe. Working as a bedside nurse, you have your patient to deal with, you have your patient relatives to deal with, you have the changing policies that happen every day you come to work, new policy, new rule happening within the healthcare system. You have all this to constantly deal with. It's a lot to deal with as a bedside nurse. Yes. So I feel there are lots of things that should be looked into. Yes. To make nurses more comfortable, to make bedside nurses more comfortable to work and to function perfectly well while practicing and while performing their job. As I said earlier, bedside nurses are expected to do more with little. Yes, they keep adapting to all the changes happening, keep adapting to every other work personnel they come in contact with, because they have to like accommodate every other work personnel. Everybody is on the nurse this, nurse that. The physio, they keep asking the nurse. Everybody put out asking the nurse. The doctors asking the nurse. Everybody is just on the nurse. Patients are asking the nurse. Patient relatives are talking to the nurse. Everybody have to ask the nurse one or two things, and the nurse has to do what? Have all this to deal with. I feel the bedside nurses should be well encouraged. I feel they should be considered. Yes, and giving more attention. They need that attention. They need to be heard. You need to feel what they feel as well, because working as a bedside nurse can be very, very tasking. I feel the bully from all angle is making some nurses to leave bedside nursing, and if this continues, it's going to leave the bedside nursing in a state of wonder. Yes, why do I say so? There are bullies that happens within the bedside nursing system, whereby the patient, the nurses has the relatives, so many relatives to deal with, so many things. Work task is so demanding. The work task is too much to achieve before you finish your shift. You have to do a whole lot of things. I feel the bedside nurses need to be appreciated more. I feel they need to be paid more. Yes, of course. I feel they need to be heard. I feel they need to express themselves more, because a lot is happening within the bedside nursing system. Yes, the bedside nurses, they have a lot going on with them. Yes, they have a lot to deal with. You are coming to work, you have so many patients to look after. You have the relatives to look after. Of course, if you're looking after a patient, you're looking after the whole system. You are looking after the whole system, to be honest. And I feel there are bullies going on within the bedside nursing system and should be looked into, because if nothing is done about this, I feel it's going to make more nurses to leave the bedside nursing, and this is going to actually leave the bedside nursing in a state of wonder. And this should be targeted, and there are so many things that can be done to make sure the bedside nurses are comfortable. Yes, the bedside nurses, they need to be comfortable. While other health professionals are enjoying their job, they feel happy coming to work. Like every other aspect of nurses, I feel they're happy, they come to work looking glamorous. I feel bedside nurses should also have the opportunity to feel the same. Yeah, bedside nurses can have less job roles, like they can have less job by giving them lesser patients, or the number of patients they can actually be able to handle. Yeah, not giving them so many patients at the same time. You see a nurse coming into work and she's looking after 10 patients, 12 patients. That is so tasking and demanding on this bedside nurse, and it's not very healthy. Yeah, for the nurse to look after this number of patients. Yes, other aspect of nursing, they just feel good coming to work. I feel bedside nurses should be given the opportunity to feel happy while working as well. Okay, they should just be happy while coming to work, and they should be feeling happy carrying out their responsibilities or carrying out their duties as a nurse. Yes, this is my own opinion and suggestion. I don't know how you feel. I don't know what you feel about this particular topic. I'm still making some research, and just to find out why nurses are leaving the bedside nursing. Yes, I'm still making this research. And also, I want to hear from you. What is your own opinion? What do you think that is making nurses to leave this bedside nursing? What do you think? Let me just hear your own opinion in this comment section. Yeah, I'm going to stop here for now. See you in my next one. Bye.